Hello. I believe you are doing good. I know you might be aware of anemia. Anemia is a condition in which the number of red blood cells or the hemoglobin concentration within them is lower than normal. Hemoglobin is needed to carry oxygen, and if you have too few or abnormal red blood cells, or not enough hemoglobin, there will be a decreased capacity of the blood to carry oxygen to the body's tissues. This results in symptoms such as fatigue, weakness, dizziness, and shortness of breath, among others. The optimal hemoglobin concentration needed to meet physiologic needs varies by age, sex, elevation of residence, smoking habits, and pregnancy status. The most common causes of anemia include nutritional deficiencies, particularly iron deficiency, though deficiencies in folate, vitamins B12 and A are also important causes, hemoglobinopathies, and infectious diseases, such as malaria, tuberculosis, HIV, and parasitic infections. Anemia is a serious global public health problem that particularly affects young children and pregnant women. WHO estimates that 42% of children less than 5 years of age and 40% of pregnant women worldwide are anemic. Anemia can cause a range of symptoms including fatigue, weakness, dizziness, and drowsiness. Children and pregnant women are especially vulnerable, with an increased risk of maternal and child mortality. The prevalence of anemia remains high globally, particularly in low-income settings, where a significant proportion of young children and women of childbearing age can be assumed to be anemic. Iron deficiency anemia has also been shown to affect cognitive and physical development in children and reduce productivity in adults. Anemia is an indicator of both poor nutrition and poor health. It is problematic on its own, but it can also impact other global nutritional concerns such as stunting and wasting, low birth weight and childhood overweight and obesity due to lack of energy to exercise, school performance in children and reduced work productivity in adults due to anemia can have further social and economic impacts for the individual and family. While iron deficiency anemia is the most common form and is relatively easy to treat through dietary changes, other forms of anemia require health interventions that may be less accessible. Accurate characterization of anemia is critical to understand the burden and epidemiology of this problem, for planning public health interventions, and for clinical care of people across the life course. Take care about your micro-mineral intake. See you soon. Namaste.